Right, I think we might get started. We've got some really good attendance tonight, so I'm happy to kick off. So just wanting to welcome everyone to the Head to Health phone service webinar that we're running this evening. And I would like to firstly call on Adam McMurray, Program Coordinator in the commissioning team at Gold Coast Primary Health Network, to do an acknowledgement to country.
Thank you, Jackie. I'd like to acknowledge and pay our respects to the land and the traditional practices of the families of the Yugambeh language region of southeast Queensland, their elders past and present, and to those emerging. And I'd also like to acknowledge the many Aboriginal people from other regions, as well as the Torres Strait and South Sea Islander people who now live in the local area and have made such an important contribution to our community.
Thank you, Adam. Just wanting to run through just a little bit of housekeeping for this session. So of note is that we will be recording this session, and the recording will be made available for people after the session, and we're likely to also put it on our website so it can be re-accessed at any point in time. We've already started the recording, just so people know. Can I ask that people please keep their camera and microphone off for the duration of the webinar until we maybe get into question sessions, but by and large, if you could keep your camera and microphone off until directed, that would be great. The other is we are going to use the chat function in the Zoom meeting as a key way for you or for us to collate any questions that people have throughout the session. So if you're thinking you've got a question, please post it in the chat function to everyone. That means everyone will be able to see your question, and what we will do when we're getting to the latter stages of this session, we will have question answer time where we will run through the questions that have been posted in the chat. The other kind of thing to just point out is that if in particular you lose internet during the session, just go back to your Zoom link and you're able to click on that and link back in, and the host for this session will let you back in. All right. So in terms of, I guess, Head to Health and the phone service that we have on offer in this region, there's a couple of really key points to note broadly around the service. So the Head to Health phone service was announced as part of the Mental Health and Suicide Prevention Package in the 2021-22 federal budget. It is a national service offer funded by Department of Health, and it is now available in the 31 primary health network regions across Australia. So clearly this is, I guess, certainly a national strategy by the federal government, supported and fed down the pipeline by Department of Health to all primary networks to commission or deliver in each of the primary health network regions across Australia. For our region, we are fortunate to have a very experienced provider in primary and community care services to be our provider of the Head to Health phone service. And certainly of note in terms of context to this service, it is a welcoming, accessible service where it offers a central entry point to people who require support with any mental health concerns that they are experiencing, particularly in regard to linkages to other services and or linkage to any key mental health resources that could assist them in addressing their concerns. So key points to note is to reinforce it is a phone service predominantly. There's a national 1800 number on the screen currently. That is the national number, and we'll talk through in particular how does that work for our region. The service in our region is available from 8:30 to 5 and can be accessed by people of all ages. and it doesn't necessarily need to be accessed by consumers only. It can be a GP inquiring on behalf of a patient, psychiatrist, a family or carer member, or someone just self-referring or wanting to investigate, I guess, information or options for themselves. So before we go into more detail around the actual service, I just thought I'd introduce key speakers for this session tonight. So my name's Jackie Gregg and I'm the Director of Commissioning at Gold Coast Primary Health Network. We heard from Adam McMurray around our acknowledgement to country just now. We also have Casey McPherson, who is Gold Coast Primary Health Network Initial Assessment and Referral Training Support Officer. And we'll also hear from Josie Story, who is the Clinical Services Manager for Primary and Community Care Services, who, as mentioned, are our service provider for their Head to Health phone service. Before we dive into a bit of detail in a couple of slides that we've got prepared, thought it would be good to watch a brief video that we've collated that will give you some good insight into the Head to Health phone service in our region.
Gold Coast Primary Health Network recognises that the mental health needs of our community are diverse, in which case we need unique and flexible services to meet those needs.
The Head to Health phone service addresses a key part of our joint regional plan for mental health services on the Gold Coast. Essentially, it's our plan to ensure coordinated response, integrated services to meet the needs of our Gold Coast population.
I come across like at least 3 or 4 patients every day with mental health concerns.
The Gold Coast Primary Health Network has commissioned the organisation of primary and community care services to deliver the Head to Health phone service for the Gold Coast region.
The Head to Health phone service is available for anybody living in the Gold Coast. By calling the number and entering the postcode, the person is connected to a local mental health clinician who knows the area and can assess the person's needs.
In terms of patients, like if they can present early and if they can get access to something that's feasible for them, cost-free, so they can get treatment done in a less complicated manner. So it prevents unnecessary admissions, it prevents unnecessary consultations.
The Head to Health phone service provides an alternative entry point into the mental health system. Through a stepped care approach, the Head to Health phone service links people to the right service at the right time, depending on that particular individual's needs.
It's for young to old, and when you call, you receive a welcoming response, ensuring we can help you access the most appropriate part of the service to meet your needs.
After the assessment, if the person needs a mental health treatment plan, the clinician can, with the consent, talk to the GP and try to arrange that. If the person needs another service and a warm handover can be done, what happens is the clinician will actually speak directly with that service with the person present. After 7 days, the clinician follows up to make sure the services are in place, and with the consent, they also let the GP know what's happened.
General practices are in the transition to private billing these days, so patients hesitate to come and see their regular doctors. This is a wonderful opportunity for them to seek help by themselves without a doctor's referral, so which can prevent many complications. So as a health professional, I'm really excited to talk about this referral system, Head to Health, because it's a very helpful and meaningful, free, easily accessible and reliable source of information for both doctors and patients as well.
I'd like to call on Josie Story from Primary and Community Care Services to really speak, I guess, to the local service in our region. So happy to throw to you, Josie.
Thank you, Jackie. Hello, everyone. It's good to be here tonight. So we've been up and running with Head to Health Gold Coast since 1 July last year. We currently have 6 clinicians, including myself as a lead. We have 3 social workers and 2 registered nurses on the team. The team already has a very extensive knowledge of all Gold Coast community services and social services and programs that are out there, and are also, continually growing in that knowledge as well. We really do act as a central point for people to speak to someone about their mental health needs and services. So, every person that calls gets a very friendly, warm welcome. And we absolutely do our best to assist each person that calls. So there's a no wrong door approach to that initial assessment. And there's multiple ways that people may choose to access the service. We're primarily about service navigation, and which is, connecting people to the right mental health services at that time of their identified need, using the assessment tool, which Casey's going to speak to shortly. And as that video mentioned, wherever possible, we will warm transfer people directly to providers who have that capacity to do so. And also when calls or referrals are coming, via a GP or another health professional, we certainly, with the client's consent, will feed back to the referrer the outcome of that referral and the services that we've linked that person to. Next one, please, Jackie. It's a lovely diagram which talks about the pathways into Head to Health. So obviously we have referrals that can come via GP or via health professionals, via social services that can come to the Head to Health phone service, and also we have consumers and carers calling as well. We will if the referral has come via fax or email, we will be contacting within 1 day that person, the consumer, and obviously if the consumer calls, we are talking to them right then and there. They are speaking to an intake clinician at that very first port of call, and they are either going to be, if it is someone just needing some information, we'll be providing them information, or if they are in need of supports themselves and needing to know what services are right for them, we undertake the initial assessment and referral screening tool, which is a national tool that's being used. And from there, we determine the level of need that consumer has, and then we link them with the appropriate services to meet that level of need. So it's level 1, 2, 3, 4, and 5 are the levels of outcome from the IAR screening tool. And thank you, Jackie, for the next one. So one of the big questions that people have had is how do they register their services with Head to Health? And I think one of the key things to know is that we use multiple resources already to find out about the right services for people. So it is most likely that we will already know about your service, but we are also building an internal app with a lot more detail around services. So people can register their details with Head to Health through our email address there. We also have a medical objects ID as well, and the QR code is to our website. We are looking at putting a link on our website very shortly if this is what providers would allow them to fill in a form to give us further details about their service and their programs that they have available. And another key question has been how are we going to keep up to date with service capacity and waitlist times? And this is just an example of what we're planning to introduce in the next couple of weeks. And we are just looking at sending out an email to our very extensive provider list, which will let providers know what our understanding of their current capacity and their wait list. And then they are able to update us if there's any changes to what the knowledge that we already have there. So on this slide here, you can see the proposed kind of email template that we're looking at sending out, and we've just topped the list of private providers that we already have that we are on our list for that. So that's where we're up to. Thank you, Jackie.
Thanks, Josie. Just wanting to introduce Casey McPherson from my commissioning team here at Gold Coast Primary Health Network. And Casey will give us a little bit more insight into, I guess, broader pieces around the Head to Health strategy from the Commonwealth, and give us a little bit more clarification on some key components that sit behind the Head to Health phone service. So over to you, Casey.
Thanks, Jackie. So as Jackie mentioned and Malcolm in the video, Head to Health is part of a national strategy to support the stepped care approach to mental health and to support people accessing the right service intensity at the right time. So nationally, there's a three-pronged approach to Head to Health. And we acknowledge that, people in our region live and work across different PHN regions. So we really want to address what's happening across the country because there may be some confusion. So with the Head to Health centres, unfortunately, our region hasn't got funding at the moment for a Head to Health centre, but you may hear of Head to Health centres, hubs or satellites where people can go for service delivery and to access support. There's also a Head to Health website, which has existed for quite a long time as a digital resource with all sorts of digital interventions that people can access. So the Head to Health website is currently being reviewed and redeveloped to be a little bit more consumer friendly and to also have a service navigation part where it will connect in with things like the National Health Services Directory. And then the third element of the Head to Health national strategy is the Head to Health phone service, which is what we have in our region. And that's the national number that then redirects through to our locally delivered service by PCCS. Over to the next slide. Thanks, Jackie. So I just wanted to give you a little bit of a background on the initial assessment and referral decision support tool and the guidance that sits behind that. So initial assessment and referral is the guidance that is supporting how Head to Health are making their referral decisions. And it's something that's also available across the primary health sector. It's something that is a key national strategy that's been brought around to support that stepped care approach to mental health and connecting people in with the right level of care at the right time. So the idea behind the IAR is that people will have their needs assessed in a holistic approach, grabbing just enough information to be able to make an appropriate referral decision. It's not a full and comprehensive mental health assessment. It is just a decision support tool to assist with that referral decision, because we know that if people are referred through to a service without having all of the essential information collected, it's more likely that that referral is going to be inappropriate. And someone may then need to be re-referred to a different service once they have that initial consultation. And of course, that's something we really want to avoid. We also know that when we under-service people, they're not going to get outcomes, but also when we over-service people, they're less likely to get outcomes as the burden of care will outweigh the benefit. So we're wanting to really support people being connected in with that right level of care the first time around. And that's what this initiative is trying to support. By bringing in IAR, it's also hoping to create a little bit more transparency and clearer communication between services in how referrals are assessed and how information is communicated between those services. So we hear across the sector quite often the frustration that comes from a referral being rejected, and quite often it's just a miscommunication around how different services are interpreting or gathering their information. So by implementing IAR nationally, it's the hope that we'll have a more consistent language across the sectors and we'll have a bit more clarity around how those referrals are being assessed. I'm ready for the next slide. Thanks, Jackie. So the IAR looks at 8 initial assessment domains. So these are all things that would be familiar to everyone when you're making a mental health assessment. So it's prompting the user to look at these 8 domains around what's going on in someone's life in terms of their primary symptoms, as well as their contextual things going on in their life. So within these 8 initial assessment domains, it's just grabbing the key information, and then it has red flags and circuit breakers of information to help make that determination. So behind these 8 assessment domains, there is a whole rating guide and an online tool that spits out to the 5 levels of care. So from these, I think there's 496,000 different ways that it can lead to the 5 different levels of care. Jump to the next slide. Thanks, Jackie. So when we look at the 5 levels of care, these are, this is language that you'd be used to seeing, but in the past, we haven't had a lot of clear definition across the sector around how we define a moderate intensity service, a low intensity service, etc. So the IAR really provides a lot more definition around these. This is the very shortened version of the definitions, but you can jump onto IAR to see the full service intensity description. When we're talking about the levels of care, it's important to understand that it's referring to the service intensity rather than the symptom severity. So these service intensities are looking at the intervention that people will be getting in terms of the frequency, they're transdiagnostic and they can be delivered by anyone at any different service intensity. It's not a one size fits all for certain clinicians only delivering a certain intensity. So when we look at this in the context of our region, levels 1 to 4 are what we see looked after in the primary care sector, and then level 5 is things that are delivered by Gold Coast Health. Next slide, thanks, Jackie. So the IAR Decision Support Tool is an online platform that's been developed by the department. We do have training available that's a 2-hour training on how to use the tool, and the tool is also being integrated into GP software so that it can be supported for further use across the country. And this is what is being used in Head to Health to support those referral decisions. So we've just dropped a link into the chat for the IAR online. And if you're wanting to jump into there, you can have a look at the further detail of the rating guides for the 8 domains and also how those levels of care are defined. Next slide. So I just wanted to take a quick opportunity to let everyone know that we will have some training available in the region in initial assessment and referral. So as part of the national strategy, there's an objective to train 50% of GPs in the country and how to use the IAR DST. As we've mentioned, all of the Head to Health phone services across the country are using IAR to support their referral decisions. And there's support from Gold Coast Health and the hospital and health services in supporting this work. It's not a tool that's designed to be used in the hospital system, but supporting what's happening in primary care, because it will impact how people are flowing through our systems and hopefully distribute some of the burden on certain services and really assist with getting people to that right service the first time. So if you are interested in IAR training, you can jump onto our website where we've just dropped a link into the chat. For GPs, because it's a key national objective, there's a reimbursement of $300 to incentivise attending GP training, and you're able to self-register for CPD points as well. But any health professional can be attending IAR training. There's local options, or you can also jump onto national training sessions, which are promoted on our website. Thanks, Jackie.
Thank you, Casey. We're now at the session component where we really like to really explore any questions that anyone on this session would like to pose. I can see in the chat there's been a couple of questions that I think have already been answered. Just to call out a couple there. PCCS is the abbreviated version for Primary and Community Care Services, and they are our sole service provider for the Head to Health phone service in our region. And there is a question here also around, is there a combined list for contact numbers for other areas? So just to clarify around the 31 Primary Health Network regions, there are 31 regions across Australia, and each one of those regions has their own Head to Health phone service commissioned, if that wasn't clear. In terms of, I guess, pathways or ways into service, as mentioned in the video, it's largely, or routing of calls through to each of the phone services around Australia is by way of postcode. So when you ring the 1-800 number, you're asked to enter a postcode, and then that routes the call through to the regional service provider. So just thought that might be worthwhile just explaining that. Adam, is there any other kind of key queries in the chat?
Just having some of the questions are coming in now. Just a question from Lisa. Do you have an update about psychological services from GCPHN after the 6th, or after June this year?
My assumption that relates really to some flow that would otherwise have come into maybe the previous kind of service offering from primary and community care services, which we called referral, intake and triage service. So now that service has now been repurposed and shaped into the Head to Health phone service. And in terms of, I guess, flow of, say, GP referrals or referrals from other providers that previously came into PCCS and were, I guess, garnished and referred out to our psychological services providers, really the Head to Health phone service now has been shaped to oversee and manage those referrals moving forward. And as an update, Lisa and any other GPs that are on this session, the change in that psychological services program is significant. That full service offering will be decommissioned by the end of June this year. And whilst that service is steadily declining in service offer, we have a new service offer with our Supporting Minds service. So Wesley Mission Queensland has secured the new service, which has a blend of clinicians and non-clinicians providing now that new service offering, which was previously our psychological services program. Just to add to that as well, Calwyn have also been commissioned as a key provider in our region for this service for young Indigenous people aged 0 to 19 as well. So there's an Indigenous specific kind of service offering now in that service context. Happy for anyone to jump on our website. There's certainly more information in there specifically around our Supporting Minds service offering moving forward. And there's also some key information around, on our website as well around the decommissioning of our psychological services program.
Thanks, Jackie. Just one more question there from Darren as well, who's just mentioned that he can see, quite a demand for the service and probably that consideration around, I guess, the influx of referrals that will be coming that way. So Darren's question is there or has there been an increase in funding for services that we'll be referring to? There's a change in service offerings where people can be referred to, Darren. There's a few different answers to that. In terms of changes in service offering, I guess, particularly if I call out Supporting Minds in particular, that service offering has really shifted into a space where there's, I guess, individual support offered to consumers, but also a range of group support offerings to individuals. So whilst there hasn't been a significant increase in total funding for, say, mental health service delivery from a PHM perspective, or I can't really see that more broadly speaking either from other funders in our region, certainly from a service design perspective, we have really thought through services that we commission to probably certainly be able to service a greater number of consumers by way of offering individual and group-based supports where relevant and appropriate for their needs, of course. Thanks, Jackie. Hope that answers your question, Darren. That's it for the moment in the chat.
Probably just another element to maybe Darren's question was, I guess, a need or a high demand for particularly the Head to Health phone service offering even now and then moving forward. It is something that every PHN region with a Head to Health phone service, so that's all of us, are really needing to think through, particularly for our Head to Health phone service in and of itself. So we have a reasonable amount of depth in staffing in that service currently, although we are going to keep an eye on, I guess, service demand in particular, mindful as well that the Commonwealth Government is likely to deliver down the pipeline very shortly a national marketing campaign for the Head to Health phone service. So obviously the PHN and primary and community care services are aware of that and aiming to gear up to manage a much greater demand for the phone service in particular. I guess what we do see is really one of the key benefits for the Head to Health phone service is that I think some of the service expectation on the approach with supporting people with mental health concerns has always been to really consider a service offering or a program in the region as the solution. And where we feel enabled and supported, I think, with a Head to Health phone service is that we have the intake and assessment referral tool or decision support tool as the key backbone of the service. And the main gain or enabler in that space is that at times it will be identified that people are certainly assessed as being as that step 1 or 2, where potentially information and resources are the key components of their option or best solution for them at that point in time, rather than them going through to a service delivery program. So now we've got, I guess, in the Head to Health phone service offering by way of website and phone service, there's information and evidence-based resources available via the Head to Health website. And we'd be hopeful, I guess, moving forward, that there is more appreciation for maybe some online resources and tools that could benefit people now and then into the future. And certainly not only for consumers, but family and carers and service providers to more readily identify with those online resources and tools is probably a really key growth component for us now and then moving forward, to not always see a service delivery program as being the only solution or the main solution for people who are aiming to address their mental health concerns or needs.
Thanks, Jackie. Darren's just also questioned there, has there been a review date set for the evaluation of the service to assess any successes?
Oh, I might throw to Casey on that one. I think, Casey, maybe some read from the National Community of Practice might be useful to bring in there if you've got some information from that space that might inform Darren's further question.
Yeah, certainly. So we're collecting a significant amount of data nationally for all of the services to monitor how implementation and success of the service is going. So there's all from the beginning, the measures are being put in place to be collecting all of our volumes, our consumer satisfaction, which is sent to users of the service following a phone call, and then also capturing data around when people call, how long the call's going for, and what the outcome is in terms of the recommended level of care and then the service intensity that they're being connected through to. Obviously, this is it's an activity that's looking at sort of supporting system change. So it's hard to measure that on a service level. There is, on the other side with the IAR rollout, they're looking at doing a national evaluation of that. The details of the timeframe and when they'll be doing that haven't been released yet, but the evaluation of IAR will sort of help mirror what's going on with Head to Health as well. So it's something that we'll see through our ongoing monitoring of how people are accessing services that we fund and how demand is tracking through those services as well. So it'll be an ongoing monitoring piece to look at success. Thanks,
Casey. This one's probably for you, Josie, the next one. Would you mainly refer to government-funded services or private service providers?
Thanks, Adam. I think we will link people in with whatever services are best for them. So we have found already that we're not only linking in with mental health services, whether they be private or funded services, but also with social services as well as those needs are presenting. So, yeah, everyone and anyone we will be linking people in with.
I think probably just on a side note there, Josie, I think it's useful to note as well, and I know it comes up in discussions occasionally, just to call out that the Head to Health phone service is not a crisis mental health service, but if at any point in time, potentially, I guess PCCS are fielding a query or from particularly, I guess, a consumer usually where the level of their mental health concern appears to be quite significant, potentially then that does require a referral or an action really to address or support that person, potentially to go into ED at the hospital. So that might be maybe QAS might be called to support that person, or something of the like. Interesting, I guess, interface in that scenario as well around us having, I guess, the Head to Health phone service offering, which is very much community facing, and just wanting to acknowledge that we still have our 1300 MH call, so mental health call number, that's certainly there for people that have high level, more acute mental health concerns that really need to go straight through to the hospital service. So that's a Queensland Health Hospital based call line. So just useful to point out the difference between the 1-800 Head to Health phone service line and the 1300 MH call line. Obviously the 1300 MH call line is for people with more acute mental health concerns. Don't know if you wanted to add anything further to that, Josie.
No, I just say it certainly does happen that that's the whole purpose of having that IAR tool. It helps us determine that level of need. So we do link people in with the acute care team or the 1300 mental health or QAS as needed. And we're certainly working really closely with the 1300 mental health call number to look at, referral pathways between Head to Health and that phone line, and vice versa, as as that 1300 number has traditionally fielded all and every call inquiry around mental health for the region. So we're looking to hopefully, to support that line as well. So, yeah.
Thanks, Josie. Jackie, that appears to be it for the moment, as far as questions go in the chat.
Thank you. Maybe I'll just call for any last questions to be posted in the chat. And maybe, Casey, for you to consider Josie, whether you might want to raise any other key points to note before we maybe close out this evening's session. Can't see any more information coming through on the chat. Thank you, Darren. That's a lovely comment. Thank you. I think probably key to note, you'll probably see by the video, is that there's really some lovely shared ownership in the region between primary and community care services, primary health network, and in particular Gold Coast Hospital, to work together on this initiative to create success and make it work. Feel very thankful to be part of a region that does work really nicely together around really key initiatives in this space. Casey or Josie, did you have any kind of points or queries that you wanted to raise or bring forward before we finalise tonight?
I'd say we've probably covered the key information from my perspective, but if anyone does have questions arise, please jump onto our website, onto the Head to Health page, and you can log questions there, or you can get in touch with us directly. And also any feedback on how things are operating in the system as we roll out IAR across the sector. If you have feedback around how services could be working together better, or how we can be, moving consumers more clearly through systems, then please let us know. This is all new activity, so we want to support that it's getting the best outcomes for our consumers.
Thanks, Casey.
Thanks, Jackie. I would just say that we, in a time of transition, but we're all very committed to making sure that people do get the right support at the right time. So we, as providers, certainly need to know the services that are out there, capacity and wait lists and all those kind of things. So we will be putting our mark out there for where you can access that information that you need, and providing ways that you can let us know about your service as well. So, yeah, thank you for tonight.
Thanks, Josie. I just note Cassandra just asked if the recording can be sent out to attendees. That was our plan, Cassandra. So we will send out a recording, but also make it available on our website as well for people to access. Sorry, I just saw another query. As a private service provider, how do I get onto your list? So maybe Josie, can you just remind Elizabeth how she can get on?
Yeah, Elizabeth, if we just go back a couple of slides, if possible,
Yep.
there is the immediately there's the Head to Health email address where you can certainly provide information there. At that email address, and that QR code links to our PCCS Head to Health website, and very soon we are looking at having a link on there where you can add your information into a template of everything that we like to know, is to be able to get people the services at the right time. So hope that helps, Elizabeth.
Thanks, Josie. I think I'll call this evening to a close. Just before I finish up, I really appreciate people linking into this this session this evening. We hope that you found it really informative and helpful to understand our Head to Health phone service offering in the Gold Coast region. If you have any further questions or queries, please feel free to reach out to Primary and Community Care Services and or Gold Coast Primary Health Network for any questions that you'd like to raise. Certainly, we're happy to really hear your feedback. Like Josie and Casey have mentioned, we are in a transition phase with a fairly significant service offering with this Head to Health phone service, and certainly have a really keen appetite to ensure effective implementation, safety for consumers, and certainly outcomes for our service system. And certainly this service offering provides those opportunities to us, and in particular provides a really key support now moving forward for consumers in need. So thanks again for attending this evening. Really appreciate your support.